Welcome to Dateline Health. This is Fred Lippman coming to you from the Alan B. Levan Innovation Center, which is a combined element of coordination between Nova Southeastern University and the Commission of Broward County. And today we have a very exciting, I believe, a very exciting broadcast to present to you. There's a lot of communications to us relative to the issue of cancer, particularly, and other diseases. But it always comes to my mind that over the years that we've been doing this show, which is well over 25 years, one of the best shows that we've ever done had to do with the people associated with Nicklaus Children's Hospital. So we've got a trio here today. Let me first say hello to Maggie Eidson Fader. You're here. You're a pediatric hematologist and oncologist. So welcome, Dr. Fader.
Thank you. Happy to be here.
Welcome, David Mancuso, who is a Ph.D. Pharm.D, who is the Executive Director of Pharmacy and Lab Services at the center. Dr. Mancuso.
Good morning, and I'm very excited to be here today.
Well, it's wonderful to know that we have a pharmacist in this particular. Most people who've been watching us over the years recognize that my first profession was pharmacy. But that ended when I disassociated by selling to my pharmacies to other corporate entities, and I got into education. So welcome. And of course, our third guest is Diana Azzam, who is a Ph.D., and she's an assistant professor at FIU. Welcome.
Good morning. Thank you for having me.
Thank you for being here. Let's start out with someone tell me what is a brief, or give me an overview of precision medicine.
Yeah, I can get started. So precision medicine today is commonly using DNA profiling to look for mutations and try to identify targeted drugs for cancer patients. So mostly DNA profiling, looking for mutations and trying to identify matched drugs using genomics. So really trying to find the right drug for the right patient at the right time. That's what precision medicine is all about.
Well, let me just take this a little step further, and maybe we'll get our Pharm.D involved as well. How far are we from where we were, I guess, almost 10 years ago? The COVID epidemic really brought the attention to the general public of the ability to create products, otherwise known as pharmaceuticals, to aid them to get through this deadly thing. Am I on the right track?
Yeah, I think you're exactly on the right track. I think the COVID pandemic brought to the forefront the investigation of these pharmaceuticals and other drug therapies through precision medicine. And one of them is the advancement of not only genetics, but pharmacogenetics. And pharmacogenetics pretty much is the field of pharmacology that uses genetics in order to understand drug variability, but a lot of pharmaceutical companies are also using it for drug development. So you are exactly correct. Yeah.
Has that, in your mind, created new associations with entities around the world in order for us to have more medicinals available for treatments of many diseases, including the cancer issues that we're talking about today?
I believe so. There has been many regarding the collaborations, not only what we do locally, but internationally. There has been many collaborations, not only with entities that are international. that are related to the genomic medicine, but also to the research that's being done in collaboration with other institutions. And it was definitely a catalyst. Unfortunately, COVID-19 brought that to the table, but the discoveries of new technologies, the advancement also of genomics has brought, these new ways that we can personalize medicine, and it's being, not only done locally, as we see in this collaboration with Nicklaus and FIU, but also, internationally. Absolutely.
Well, let's get down to the basic question. What is precision medicine? What is it?
What we're going to tell you about is what, what is the basis of our collaboration is functional precision medicine, which is a relatively new field, and it really combines what I just discussed is genomics with drug sensitivity testing, which is testing of FDA-approved drugs, all these drugs that you mentioned that have been approved over the years by the FDA directly on patient cells, tumor cells in the lab, and identifying what works and what doesn't for each individual patient. So it's the complementation and the integration of genomics with drug sensitivity testing. And that's functional precision medicine. And that's where we came in and collaborated together to implement functional precision medicine to identify treatment options for cancer patients that have exhausted standard of care.
I can elaborate on that just a little bit too from the clinical side. For the physician, we treat cancer and we see a certain number of patients with certain types of diseases, and we offer them treatment regimens based on what we know has the best odds of curing the condition. But in every regimen, there are a percentage of patients who don't respond to what is considered the best. And so when you look at a personalized medicine approach, we want to say, why do 30% of a particular type of 30% of patients with a particular disease type not respond to what is supposed to work? What is different about the disease that those individuals have that's making them respond differently to what is supposed to be curative treatment? So what we want to do is, instead of saying that every patient with a particular type of disease, go ahead and get the same treatment, we want to find out if there is a way to tailor our treatment to that particular disease process that that particular individual has. We want to specify our treatment for the patient on an individual basis. So that's the precision part of it. We already know that we've divided cancer into subtypes, and in those subtypes there are more subtypes, and we treat those with particular regimens, but they don't work 100% of the time. So why aren't they working? So that's the question. That's what precision medicine is about.
Let me, if I'm not mistaken, I think I saw an interview of yours on a local television station. Am I correct?
National too.
Well, I can't watch every television set in every city, but I think I saw it. There's a lot of folks that wonder what's really being done, and I think that your interview enlightened the public that heard what you have to say as to what's going on at Nicklaus Children's Hospital and the use of precision medicine. Have you seen any relationship to that at all? Am I right, or am I in the right channel, Doctor?
Yeah, I think that we have had a lot of inquiries now about using this technique for these kids with these relapsed conditions, rare tumors, rare cancers, and there's a point at which we don't know what will cure a particular disease anymore, and we're just trying to come up with the best regimen possible based on similar types of cases as a whole. And so people, physicians and parents have been reaching out to say, well, is my child a candidate for this type of investigation? Is there some way we can look and see if there's something we can find that might work against these cancer cells that my child has? And so I think that there's some definite interest, and I think that this type of endeavor getting published and getting recognized and being more visible to the world is kind of opening their eyes as to this might be another option.
You know, one of the things that comes to my mind, and of course we're all focusing in on the hospital that you're all involved with, which is Nicklaus Children's Hospital and the children, but you know, cancer sees its way through this broad spectrum of the living species.
You bring up a good point. So as a scientist, I developed this approach and been working really closely with Dr. Fader and Nicklaus Children's Hospital team to implement it in children, but I'm also working with other clinical teams on adult cancers and relapse refractory adult cancer types. So we have a similar study open with Cleveland Clinic, Florida, to implement this approach for relapse refractory patients.
What, and I don't know who's going to answer this, but what are the most significant successes in precision medicine as far as you see today?
Yeah, that can be answered on a lot of different aspects. So we can talk about some of the successes of our particular study, or you can just talk about precision medicine in general. One thing that I think people have been doing across the world in the last decade is really looking into the genomics of tumors. And we do what we call next generation sequencing of cancer cells in a particular patient and look for targets that we can use to treat. So if a patient ends up having a mutation in a particular target, then some of those targets have drugs that are made specifically to hit those targets and kill those cells. I think that has been a development that has made a huge difference in the cancer world over the last 10 years or more. But it seems to be picking up pace as we have found the pharmaceutical world coming up with more and more drugs against these targets. So that science has really, I think, helped a lot of us as clinicians and work towards investigations that are going to use those targeted therapies against their targets on an individual basis. So we no longer have to say that a pelvic sarcoma is a pelvic sarcoma. We can say now that this is a pelvic sarcoma with an NTRK fusion. And an NTRK fusion has a drug that works against that fusion with a lot of success. About 85% of patients respond to that drug. Previously, they would have been treated with a variety of chemotherapy regimens that usually did not work. So that is one example amongst many of how precision medicine, one technique in the world of precision medicine, has changed the treatment in the cancer world. And that can be applied to breast cancers, colon cancers, renal cell carcinomas, et cetera.
Yes, and that reason I bring it up, and I know I don't want to go away from Nicklaus Children's Hospital, but I think the whole essence of dealing with this insidious disease known as cancer, there's so the details that I read, which I'm sure you read too, is the incredible number, for example, of males that end up with prostate cancer and females that end up with breast cancer, et cetera, et cetera. And I know that moves away from your challenges and your directions and your successes at Nicklaus, but it sounds to me, and again, I think it was just I guess supported by the recent comments, that everything that you all do doesn't just sit with your knowledge base and your remarkable abilities to fight cancer in children beyond the general community.
I think that's exactly the goal, is that this isn't just to help our patients here at this hospital or even just for pediatric cancer. This is hopefully a technique that will, as Diana alluded to, there are other investigations going on in adult diseases as well. Her particular trial is looking at adult sarcomas, but hopefully if this works out and we find that this is an addition to precision medicine, this functional testing that we're trying to utilize, hopefully that will be applicable to all types of cancers across the globe, and this will help people of all ages with all types of diseases be able to personalize their treatment regimen to what they have.
Institutions as wonderful as the Nicklaus Hospital, Children's Hospital, needs the support of the general public. It's not just, you know, there's a patient, you get a designated fee for keep dealing with the patient, but you know there needs to be an external system of giving to entities such as yours. And I think I brought this up already 2 or 3 times, but I really would love to see the public enjoy the knowledge of all of the great work that you all are doing. And whether it's precision medicine or whether it's the issues of the application of the medicine, the communications internationally, et cetera, that we all went through. I'm just wondering, if you had your wishes, each one of you, what would you wish for your program?
So I think that we really appreciate that sentiment of wanting to support us as a hospital and our endeavors here. I think that there is kind of a culture in South Florida, and maybe it's in other places as well, from what I hear from other oncologists, that, you know, there's a knee-jerk reaction. Oh, your child has cancer, go to St. Jude. Oh, your child has, you know, there's certain people that will tell you that they've been fed all the advertising, and those institutions are fantastic, that type of institution, and Memorial Sloan Kettering and MD Anderson. But at all of these local institutions across the country, there is a lot of good work going on as well. And I think that part of the reason that you can look at the colleagues that I work with, a lot of them are locals from South Florida that came back, and they went off to these great institutions to learn, and they wanted to bring that information back home and then continue to investigate their specialty and further the cause locally. So I think a lot of people don't recognize how much is going on in their own backyard. You know, that you actually have a fantastic institution down the road that's doing a lot of good work for a lot of very needy kids, and needy on a spectrum. Needy as in their diagnosis is very difficult to treat. They need very intense subspecialty care. They need personalized medicine, and even needy on the financial scale. You know, in this hospital, we treat about 70% of our population with either Medicaid or no insurance. So state insurance or zero insurance. And somebody has to help pay for that. Medicine is an expensive thing. It's not going off to your doctors. It's, you know, not being squandered, but paying for these novel, fancy drugs that sometimes need to be used, or paying for these investigative type of studies have to be supported, or else we're not going to make any progress.
An entity which is presented through the decision of goodness and welfare and really care for your fellow human being. And that's what I see at the Nicklaus Hospital. And I'm glad that you said what you just said. So
I want to add a comment that I hope that the collaboration that's happening between Nicklaus Children's Hospital and FIU as a research institution is a role model for everybody out there, that this collaboration between a research institution and a healthcare hospital is so important. And I hope that we encourage everybody to collaborate in that aspect, because that's how we can move, make discoveries and bring technologies to patients and improve patient care.
Well, I'd be less than candid if I didn't mention the fact that here at Nova Southeastern University, we have a cancer resource center, and I invite you to communicate with our people. How do you accomplish this without having the type of team structure that you have at Nicklaus Hospital?
No, I was going to say, so going back, of course, because we're here about, what we do in cancer, but as a whole, pediatric cancer has always relied on collaboration with other institutions across the entire globe. A lot of our consortiums include not only across the United States, but facilities even in Europe and Asia, other places, South America. So we really do need that, and we need that because what we do is affecting a population that is small. And if we all tried to work in our little box and only investigate the cases that we saw, we'd have a very limited view of how the disease acts and how the children handle therapy and how they handle the side effects and how outcomes are measured. So collaborative approaches have been essential for advancing pediatric cancer, and that's why most of the notable children's hospitals are part of these consortiums, such as the Children's Oncology Group, Beat Childhood Cancer, and other organizations like that, that really open sites across the entire nation and internationally to be able to pool all of our experiences and our data and see how we can help the kids together. And then now I think that this approach that we've done with FIU and Nicklaus working together, you know, the hospital and the university have a relationship where all of us physicians over here at Nicklaus are clinical faculty for the FIU students when they're getting their education and training in medicine. And so that relationship has fostered this ability to work directly with laboratory science and clinical science. So now we're getting the research from both sides together, and that's kind of helped us to create this world where we can take the child specimen, have it analyzed individually, and then utilize that data back to the child. So it's another kind of collaboration that I think is really special. We have a lot of places where you talk about translational medicine, and it usually means that we take something from science and now use that laboratory setting-based learning for a trial for the patient. In this particular case, that trial is the patient's individual trial, and every single person is getting their unique set of information and their unique treatment plan, and that's only doable when you collaborate. There would be no other way to get this done.
I know that you're all very well groomed in your knowledge and your history, and it's a magnificent thing to have, in my mind, to have a children's, the Nicklaus Children's Hospital. I think that you've done an incredible job. I was affiliated with the hospital before it was called Nicklaus, and I'm really thankful that you were able to, all three of you, to show up in order to make the public who views us much more sensitive to the fact that there isn't just an entity 200 miles away or 300 miles away or 150 miles away that is dealing with, particularly in this point in time, cancer of children. I want to thank you, all three of you, for the work that you're doing. And to tell you the truth, it's a blessing knowing that you are doing what you're doing, and you need to be blessed for it. I want to thank you for showing up. This program is called Dateline Health. My name is Fred Lippman. Until next time, see you.